neuromuscular scoliosis with neurofibroma. So this is our case, a 30-year-old male from Diamond Harbour, complaining with progressive deformity in back and occasional pain and stiffness for last 2 years. He tried bracing and pain management at local hospital, but with no improvement, and then came to us at our OPD, and these are the clinical images, and the child has a family history of neurofibroma. We can see here the clinical picture of his father with lots of neurofibromas on the right upper side, and the clinical picture of that particular boy in rest of the slides, capital spot and the neurofibromas. So these are the pre-op imaging, the X-rays. We can see the right bending, neutral position, left bending and traction view of our case. So pre-operative planning, we have taken the anesthetic clearance and we planned for the posterior spinal fusion. We can see the intraoperative imaging of that particular case, and we decided to for the posterior instrumentation from T4 to L3. So our approach was, as discussed, it's a posterior approach. After proper positioning, after wide posterior release, pedicle screw and instrumentation was done, and intraoperative neuromonitoring was done to assess the neurological status and changes while the OT was going on. So our post-operative course, of course, no neurological complications was there, and radiograph shows solid fusion and alignment was maintained. These are the post-op image of that particular case, and this is the comparison slide. First, the pre-op clinical picture and the pre-op radiograph, followed by the post-op radiograph and post-op the clinical picture from back side. And from the lateral aspect, we can see the first pre-op image, followed by the radiograph and post-op radiograph and post-op clinical picture of that particular case. So after 3 months of follow-up, we can see that fusion is progressing without any complaint. So what's the conclusion? Neuromuscular scoliosis requires individual planning for individual case, and early intervention improves the functional outcomes. Surgical correction is effective in restoring the spinal alignment, and of course, multidisciplinary care is essential. Thank you.